Good morning. It is Monday, September 27th. We are live inside the Dolph Simons Jr. Family Broadcast Studio. Welcome into the Morning Medical Update. So glad you are joining us. Hope everyone had a great weekend. It is a battle so many of us face this time of year. Coughing, shortness of breath, tired, congestion. But now you have to add in the possibility of COVID. So we're going to break down how to know if you're battling fall allergies for COVID-19, and especially when it comes to your kids right now. Who really knows? Dr. Stites is back this week, so stay tuned. We're trying to track him down. Okay, so Dr. Dana Hawkinson, though, is joining us. You're always here. Good morning. How was your weekend?
It was good. You know, got to spend some time outdoors at the art fair, supporting local and other regional artists. So it was a good time to be outside. The weather was really good.
Nice. How'd we do over the weekend, numbers-wise?
Yeah, so far our cases have continued to go down over the last 7 to 10 days. We have 29 active infections in the hospital right now. I think over the weekend at some point we had like 27. Of those patients, 10 are in the ICU and 7 on the ventilator, and 37 in that recovery period. We should note that there are only 4 fully vaccinated patients here with those acute infections.
All right. We're going to get to some reporter questions. Do we have any on the line today?
Yeah, good morning. Cody Holyoke with Channel 9.
Hey, Cody.
Happy Monday,
good morning.
everyone.
Yeah.
Hi. I know that booster shots for a number of new groups are starting today. We have a reporter over in Mission where they're starting to do that. I was curious, doctors' thoughts moving forward. Also, what's your message for people who don't have the Pfizer shot and are saying, wait, what about all these people who can go get their boosters now?
Yeah, it's good. So the best data and the data that's been submitted to the FDA is about Pfizer, just as you said. We know that in the next couple weeks there will be more guidance and information about Moderna and Johnson & Johnson. So everybody who has not gotten Pfizer, just hold tight. But again, continue to take comfort in the fact that these vaccines continue to do great things and are beneficial and continue to protect against hospitalization, severe disease, and death, even this far out from vaccination. So right now there's not a lot to be concerned about as far as that goes. You still have really good protection. But if you did get Moderna or Johnson & Johnson, there will be more information coming soon from the FDA and the CDC. The other issue is, yes, we certainly are working on the boosters. We were able to do it by physician order right now. So we will be ready for those groups that are able to get that additional dosing. Does that help, Cody?
Yeah, and a question again for people who didn't get Pfizer. I've gotten a couple of questions, I'm sure you have too, on saying, wait, is it good to mix and match? Should I go try to get the booster?
No, again, I think if you got Moderna or Johnson & Johnson, I think just hold tight. Is it good to mix and match? Again, there's not a lot of data to support that and what are the exact benefits and the concerns. We do believe that it is safe, that there are certainly no large issues or major concerns with that. In the CDC guidance, it does say that in extenuating circumstances, you can mix and match. Right now, today, at this point in time, I don't feel there's any need to do that. I feel whether you got Pfizer or Moderna or Johnson & Johnson, you continue to be very well protected. If you are in that group that got Pfizer and in that group that may or may not be getting the booster or additional dosing, you can certainly start to think about doing that. But for those that got Moderna or Johnson & Johnson, you're still very well protected. I don't think there's any reason to go out and just get the Pfizer vaccine and mix and match, just as you asked about.
All right. Last question for me. The CEO of Pfizer came out yesterday, I believe, on ABC's This Week and was talking about how they're going to be submitting data to the FDA, and he said days, not weeks, about 5 to 11-year-olds. I'm curious what you're hearing about a timeline and what that might mean, especially as we start to get into flu season moving forward.
Yeah, I think that's great news. I saw that as well. So yes, submitting the data to the FDA in the next few days probably, or within the week, I think it's really good. But also what I did see, and I think it was a Washington Post article or CNN, but it will still take several weeks for that data analysis to go through. So it probably still would not be until later October till those vaccines for those younger groups are available. But that could change, certainly. We have seen how things pivot fairly quickly. But that was the best timeline I've seen, again. It was either from a CNN or a Washington Post article.
Thank you.
Other questions on the line today? All right, we are
Hey
already
guys,
getting
good morning. It's Taylor at 41.
Hey, Taylor. Good
Taylor.
morning.
I wanted to ask about this morning we had a story about Pfizer's CEO talking about getting back to normal within a year is what the timeline he laid out. But he said that yearly vaccinations would be necessary for COVID. Can you speak to some of the hesitation about the difference between telling someone, okay, you're going to need to get these 2 shots and that should be it, versus, hey, for the rest of your life, you're probably going to have yearly vaccinations, which is not necessarily what we're saying, but the idea of suggesting right now that we might have to have shots on a regular basis for many years to come, how that's weighing in on affecting people and the fear factor related to a couple of shots versus years and years of vaccines.
Yeah, no, that's a complex question. I'm not sure that I have enough time for that right now on this show. But, initially when the vaccines first came out, we did say and speculate, well, maybe we'll need yearly booster, or we'll need a yearly shot just like the influenza. But then it came out, and we do see that these vaccines provide extremely high efficacy and extremely high durability. Then you take into the account with when people do get infected, they also do get some immunity from those particular variants as well. That also will help to build further durability of that immune system. So it's really unclear what is going to happen moving on forward. I mean, it is difficult to tell people, well, now you're going to need a booster every 8 to 12 months. I don't know that there's necessarily that, but there are different lines of thinking that maybe 3 doses of vaccine overall, you will be considered fully vaccinated. So will you need any others moving on? And I think a lot of that is also going to depend on what is the epidemiology. What are those infection characteristics, not only in our country, but throughout the world? So I think that is a question that really fully can't be answered right now. I think we need to get through this first phase of offering these booster or additional dosing to those that need it, and then move on from there. It's really difficult to say. I think in the with the issues of natural infection combined with vaccination, certainly we know that for the best safety in preventing hospitalizations and those severe disease, vaccination is the best way to go about that. But how much will that provide protective immunity, long-lasting immunity? The best evidence we have is that you will still continue to have long-lasting immunity with those circulating and memory B cells and those memory T cells as well. Now, will we need further active vaccine dosing? I just don't think that's a question we can answer right now.
Taylor, do you have a follow-up?
And quick follow question on a different topic about kids and vaccines. Everything we're hearing, we expect kids, whenever if it's Pfizer that's first out, but whenever that's first available for kids 5 to 11, we expect that to be a 2-dose regimen as well to start.
So far, everything I'm hearing, yes. I believe the formulation is different in the fact that I think it's a lower dose than the adult dosing.
Okay, thank you.
Yep.
Other questions on the line? We got them? Good. Okay. Questions are in. We've got some good questions coming in from the community already this morning. We're going to get to those here in just a moment. But I want to turn to our guest today, Dr. Marissa Love. She's going to be talking about allergies, because we know that colds and coronavirus symptoms overlap, and it's very confusing. How are you today?
I'm good, thank you. How are you?
I'm good. Did you have a good weekend?
I did.
Good.
It was a beautiful weekend.
Wasn't it nice
Yes.
to be outside? Perfect storm for lots of good allergies, and it was
Yes.
windy and all that good stuff. And I know my kiddo suffers from allergies, and I just want you to just kind of lay it out. Let's jump in, get down to business as far as what are typical allergy symptoms, like typical fall allergy symptoms.
Yeah, so we are in peak weed allergen season right now. And so typical symptoms involve itchy symptoms. So itchy nose, itchy eyes, sneezing. You can have congestion of the nose. You can also have drip at the back of your throat. Sometimes allergies or fall allergens can trigger allergic asthma. So some of those patients can get a cough as well, and it can lead to an asthma exacerbation. But by and large, most people will have nasal and eye symptoms.
Can someone who allows their allergy symptoms, a lot of people suffer from allergies. We don't think of it as a big deal, but by letting it go too long, year after year after year, not coming to see a specialist like yourself, could there be long-term issues from that? Or is it just itching and sneezing and all that, just being uncomfortable?
Yeah, so many times people will have mild allergic symptoms for quite a while, and then as the seasons get longer, stronger, the allergens get more potent, and you become more reactive to the allergens, you can technically have more significant symptoms. And it's more of a quality of life issue. Some people can let their allergies go so uncontrolled that they end up getting sinus infections, but a majority of folks have just, poor quality of life, tiredness, and, fatigue from their allergies.
So there's no built-up immunity over the years. It'll change. And actually, you're saying you could be more sensitive to the allergies as time goes on.
Yeah, so technically, some people can become more sensitive as time goes on. Not everyone, but some people.
Okay, so losing taste, sense of taste and smell is something that happens with allergies. Dr. Love, last year my daughter's nurse called and said your daughter was sitting with a bunch of other kids and said, I can't taste or smell. So boom, I got a phone call immediately to come pick her up and get her tested for COVID. So that can be really confusing. So when do you recommend a patient or a parent to get tested?
Yeah, absolutely. It's quite challenging to differentiate COVID-19 symptoms, viral symptoms from allergies. So I think the biggest factor is if the patient has a fever. And then the second biggest factor would be knowing what were the exposures. And so, were they around someone who potentially was sick? Have other people in the home gotten sick? And now you're thinking this is more of a virus.
So what kind of questions then are you getting from parents? I know when kiddos come in, are parents concerned? I think it's just trying to, maybe if you could give us some advice on just how parents can really best make a good call for not just their kid, but obviously any exposures when they go to school. So we want to keep our kids safe, other kids safe, the community safe. But how do parents navigate knowing what to do? Is it better safe than sorry? Get them tested for everything? Or
yeah, absolutely. It's so difficult. We're living in very challenging times. And so I think the most important thing is everyone in the home who is 12 and up should be vaccinated for COVID-19. That's the most important thing. Number two, everyone who goes to school or goes to a public place should mask indoors. And if you're in very crowded areas outdoors, I would consider masking. Washing your hands at school is very important. If you have any of those concerning symptoms where there's a fever involved, plus the nasal symptoms like runny nose or loss of smell, then I would definitely think about calling your pediatrician to consider being tested.
So what has it been like just this last year and a half for you, treating patients during a time of COVID, especially when the symptoms mimic each other so much? But what has been some of your challenges?
Yeah, absolutely. It's been difficult, I'd say. I mean, we're all going through this together, and we're learning a lot of new information very quickly. And I think, to keep viral infections at the forefront of our mind, especially one that can spread so quickly, has been a little bit difficult. But, especially when we ask about exposures, I think that's our biggest question for families is, who have you been around? Do any of them have illness or fever? It gives us an inkling of whether it's viral or not. And another important thing is, kids have been out of school for a long time. So there's a whole petri of viruses going around.
Right.
So it can really mimic many other viruses as well.
So you're telling me there's other things other than COVID out there.
Yes, exactly.
Who knew? You've been doing this for years. You know what you're talking about. Okay. So another question is, has anybody come in complaining, thinking that they have allergies and it turns out that it's COVID?
Yeah, I've had a few patients actually, call our clinic and say, hey, I had an appointment today and I'm switching over to telehealth because I'm not sure if I have allergies or COVID. And I think that's a really great way to still touch base with your doctor, but, keep people safe. And then by and large, we find out that, they in fact do end up testing positive for COVID because they had, fever symptoms or they had other symptoms that weren't typical for allergic hay fever symptoms.
Well, it is is it true that these people who have allergies and have experienced them for many, many years, they're somewhat similar year after year, so that when you notice one thing that's sticking out, is that kind of what you're saying, to really notice and write down those symptoms? Because when one or two of those symptoms pop up you've never had before.
Exactly. So a person who has never had hay fever, runny nose, itchy nose, sneezing, congestion, has never had those seasonal symptoms before, and then all of a sudden they get all of it, pretty significantly, I would be pretty suspicious that, this might be a COVID-19 infection or a viral infection, and even more so if there was a fever involved.
All right, good to know. All right, I want to get to some community questions on this Monday. You guys always have some great ones. The first one is from Ruth. Dr. Love, for those under 12 months old, does constant fluid on ears leading to ear infections relate in any ways to having allergies? Is that something that should be checked out?
Yeah, that's a great question. The anatomy of an infant is quite small, just because they have small bodies, and so things can back up fairly quickly when they have drainage from their nose for other reasons, or other symptoms. I will say it typically takes at least 3-4 years or so to get seasonal allergic symptoms. So to develop that sensitization to tree pollen, weed pollen, grass pollen, it can take years. So it's unlikely that an infant that young would have seasonal allergies.
So I have to ask you personally, because I have an 8-year-old and her allergies have progressed over the years. It was something I thought would just be mild and go away, but I feel like they're getting worse. What kind of remedies? I mean, what are you offering people other than over-the-counter medication that it seems like year after year I've been giving, the Claritins and all those kind of things, and they kind of help, but it's not helping the overall bigger picture. Is it still allergy shots? Is there other
So the way I talk about treatment for allergies, there's I'd say probably 3 modes of treatment. One is counseling and education. So, if you are allergic to your dog and the dog sleeps in your bed, that's the first step. Let's remove the dog from the bedroom. And counseling about when these allergens come throughout the year, how to avoid them, how to take lifestyle measures to protect you inside your home as far as reducing the allergen count. That's one way to reduce exposure. And then the second way is medications. And more often than not, you're taking the right medications. It's just we're not either using them in the right technique for nose sprays, or perhaps we can go a little bit higher on the dose if it's weight-based dosing for kids. And sometimes people need to switch their medications because they're not responding to a weaker antihistamine. And then finally, there's allergy shots. And this is the patient where they've tried several different medications and they're still having quite a bit of symptoms. And then we start thinking about allergy shots. It's a very big time commitment and for allergy shots. And typically the typical treatment course is about 3 to 5 years. So it's a long treatment to decide to do allergy shots.
I like what you're saying. There's a lot you could do on your own to try to keep them at bay. So.
Yeah, absolutely. And our job is to help guide you with that,
All right. I'm bringing my kiddo to you next week, so I will find out more. So
Absolutely.
Looking forward to that. Okay, so Dr. Hawkinson, Ashley wants to know, does getting the COVID shot weaken your immune system for a period of time so that then you might be susceptible to getting dormant viruses like shingles?
No. We do know that there have been some cases of people who have gotten shingles after the vaccine. Very, very few and rare cases. But the question, does your immune system decrease or anything? There is no evidence of that. Again, going throughout your daily life, you have continual exposure to environmental antigens and things of that nature, and your immune system is continually working. Getting this little dose of vaccine, these minute amounts, are not going to affect your immune system in any negative way.
All right, send in your allergy questions for Dr. Love. Emily has one. My toddler gets allergy-like symptoms when the seasons change. What exactly causes the body to react with symptoms like runny noses? Is it true kiddos can grow out of these symptoms?
Yeah, so this is a twofold question, I'd say. So first, the way to develop an allergy is first you need exposure. So Historically, for the seasonal environmental allergens like tree allergen, weeds, grasses, molds, and then the year-round allergens, for example, dust mite, cat or dog, if you have any, you need exposure to it, and typically you need at least 3 to 4 years of seasonal exposure to develop allergies to it. And so that's the first thing. And so with time, allergies can develop and become stronger. And then these allergens come into the body. Your body remembers that allergen as being foreign, and it decides to do something about it and say, hey, we don't need that here. And it decides to create an allergic response. And that's how you get these symptoms of runny nose, congestion, ways to try to clear that allergen from your nasal cavity.
I have a question for you. What about using air filters? Are those effective? Is it just another tool in the toolbox?
Yeah, absolutely. Great question. And so that is one of the ways we do recommend trying to filter out allergens from the home. You need a HEPA air filter, HEPA, so one of those high energy particulate air filters. And it's very important to try to filter out those small particles out.
Okay, so the kind you get matters.
Mm-hmm.
Dr. Hawkinson, Shelley's asking, different strep strains going around, symptoms overlap COVID. Thoughts on home COVID tests available from CVS? I know I stuck one up my nose a few weeks back, and is that a good route to go when you don't know and you don't want to have to make an appointment to get one?
Yeah, the question was about strep. Was that the initial
It says
part?
different strains, different strep strains going around, and suggesting that the symptoms overlap COVID. So thoughts on getting a home test, just to cancel.
The typical strep throat, if we're talking about that, those symptoms typically tend to be high fever, sore throat, no cough. There isn't much overlap of symptoms compared to the common cough and cold or coronavirus, unless it is a little bit of sore throat. But again, if you're going to have cough and high fever and aches, typically not the same as strep throat. Also, there is some seasonality to strep throat as well. But again, being as we've been all masked recently and we've seen that other illnesses have gotten out of their typical seasonality, it is difficult. So certainly if you have concerns and you are having symptoms such as runny nose or fever, sore throat, cough, less likely going to be strep throat. And I think also it is very difficult to get some of those testing, so you do need to go to a physician's office. But for home testing, certainly getting the home testing for the COVID-19 tests would be an important thing to do as well.
But still, even any type of, it's still just so confusing with what's going on out at this time of year. It just, I would be nervous myself and want to get tested.
I know. I think because we know that these symptoms occur, whether it's allergies, other viruses, other illnesses, there is a concern that people will be spending a lot of money doing these home tests and doing these things. So certainly, we have access here to testing for COVID-19. If you have any questions, please call us and sign up for testing. Now, this is the PCR test, but we have a very good turnaround time as well, because we know that certainly these home tests, while very good in those instances, in those times when there is a high disease prevalence, as there is now, but they can be expensive and can be some sort of financial burden.
So on that note, Donnie says that if we had the Pfizer shot, we live in Missouri, that's where they were vaccinated. Can they come here to our hospital to get the booster? And she says that they are patients of ours. So I'm assuming yes, right?
Yeah, right now, again, we're going with physician's orders for those. If you do fall within those groups that it's recommended for a booster, or those groups that may get a booster in words of the CDC, then you could certainly come here and get that dosing. Again, it has to be at least 6 months out from the original second dose.
6 months out and from your doctor.
Yeah.
Okay. Dr. Love, Isaac has a question about what you think of the hygiene hypothesis. Are you familiar with that? Okay, so basically say that less exposure to germs in childhood compared to in the past translates to more allergies. Walk us through that.
Yeah. So the premise is that a long time ago, our grandparents did not have a whole lot of allergies. And, was it because they were out and about in the dirt all the time, or were they working out in the fields? My parents, they're a generation of farmers in the Philippines. And so was it because they were always in the field and they were exposed to all these pathogens all the time that their body just became immune to it? And so that is kind of the premise of the hygiene hypothesis, where we had moved away from that type of living into a more sterile environment. And with that sterile environment early on in life, our bodies now seeing these foreign items as, things we need to respond to and become very allergic to it. So there is that hygiene hypothesis. And, it's one thing to say that it's possible that this could be an explanation for things, but it also is another thing to note that medical interventions and diagnostics have become a lot better with the years, and so are we just noticing it more now that we have the tools to do so?
Yeah, it makes sense. Dr. Hawkinson, does this go along with your rub dirt on it thinking?
That's
right. Things have changed these days, right?
Well, wash your hands after you do.
Yes. Okay, so easy. Okay, Christy, thank you for asking this question. I may have forgot to ask Dr. Love this because my kiddo had a bloody nose yesterday. What do you recommend for a child that gets nosebleeds from allergies?
Yeah, so the number one reason typically for nosebleeds is nose picking. So make sure your child is not picking their nose.
Okay, maybe that was it.
And then number two, definitely, if you're blowing your nose a lot because of runny nose or sneezing, or the air is quite dry in the home, that can all contribute to dry nasal tissue. And so lubricating the nose. So a lot of children don't like doing this, but a saline rinse can help lubricate the inside of the nose or moisturize the inside of the nose, and also wash out those allergens, pollutants from the day.
And what about just spraying the spray stuff? Is that, I don't know if that's the saline rinse.
Yeah, a saline rinse, like so there's two versions. The big neti pot that
the
everyone
neti
remembers.
pot. Oh no, I had to do a story on the neti pot once, and they wanted me to try it out. And if you don't know what it is, you put the water up your nose and it comes out the other side. No, thank you.
A lot of my patients.
I'll take your word for it.
A lot of my patients are hesitant with that. So, and I actually, I'm not. I'll admit, I'm not a huge fan of the neti pot, but there is a saline spray that comes in a can. You can get it from Walmart, and it just says saline spray on it, and it comes out real gentle. Just it's a fine mist that goes into the nose, and they primarily use it for pediatric patients, but it works just as well for adults.
Oh, that sounds so much more pleasant. But yeah, this is probably so keep your finger out of your nose and keep it clean. Also, what about like washing your sheets and your hair, and especially kiddos outside running around? That would be probably one of those environmental things that are in your control.
Yep, a lifestyle measure that you can just do. Just take your shower at the end of the day once you're done playing outside or being outside, just to wash all of those allergens out of your hair.
Clean your body, keep your finger out of your nose, wash your hands. These are good advice. Okay, so how about this one? Emily wants to know, are allergies hereditary?
I get this question a lot. So in the sense that, I am allergic to oak trees, will my son also get allergies specifically to oak trees? Not necessarily so. However, if I have a history of an allergic disease, so allergic rhinitis like hay fever, or allergic asthma, or eczema, otherwise known as atopic dermatitis, these are all allergic conditions, and the disposition to develop an allergic condition can get passed down from generation to generation.
Okay. Makes sense. Okay. Marie says, can children get rashes with COVID-19, and how would you recognize them?
Yeah, that is a great question. So I will first let you know I'm not a dermatologist. So I'm really good at seeing a handful of rashes, but the answer is yes, you can get rashes with COVID-19. There's actually been some really great articles on the wide variety of rashes that can happen with COVID-19, because there is quite a few that can happen with it. It's not very common, but it can happen.
Isaac has another question for you as well. Have you seen anyone with allergic reactions to the COVID vaccine? what does that look like?
Yeah, so we've seen adverse reactions, so that would include non-allergic reactions as well as allergic reactions to the COVID-19 vaccine. I will say when you tease out all of these different types of reactions, and when by the time the patient comes to see us, the number of truly allergic reactions or truly anaphylactic reactions is quite low. We're looking at less than 5 per million or so doses of COVID-19 vaccine. So very, very rare to have a life-threatening anaphylactic reaction to the COVID-19 vaccine.
Dr. Hawkinson, here's a common question we get. Can you answer this one? Linda wants to know, how soon after the COVID-19 vaccine booster can you get other vaccines like the flu shot or the shingles shot?
Yeah, initially when we first started giving the COVID vaccines, it was recommended to space those out 2 weeks either side, just because we didn't know enough, we didn't have enough data, enough experience. But now the new guidance, and it has been the new guidance for quite some time, really since the pediatric 12 and over was okayed, you can give multiple doses of vaccines at the same visit. So you are able to get flu vaccine and COVID-19 vaccine at the same visit if you're able to.
Sandy wants to know, I'm traveling by air this week for the first time since this pandemic. Is it safe to eat and drink on the plane? You've done this before.
Yeah, I haven't eaten or drank on the plane. Again, I think it's just a matter of risk tolerance. Be careful. If you are going to eat and drink, just make sure you have a short period of time when you don't have your mask on. When you're doing that, maybe to take a sip or put chips in your mouth or whatever you're eating, and then put the mask back on quickly. The less time you have unmasked, the more protected you're going to be.
Yeah, they barely feed you or give you anything
Right.
to drink,
It's
sadly.
really gone down.
So unfortunately, don't count on that.
Yeah.
But you have traveled. And did you find traveling pretty safe on the few times that you've had to travel?
I think so, but again, I take extra precautions. So in the airport, I do try to distance myself as much as possible. I do have my eye protection on while in the airport, as well as the masks, of course. And then, of course, on the plane, it is, again, continuing to have my mask on and my eye protection as well. And again, I'm not typically eating or drinking while on the plane.
Okay, so Jane has a question. She has seen people citing an Israeli study showing that previous infection is more effective than the vaccines. Have you seen any reinfections hospitalized with the Delta variant? Just what are your thoughts about that way of thinking?
I think that's a big debate, that previous infection is the same or better. Actually, there's a new, I was looking at an article today, I think it was in this science update, the most recent science update in the CDC, which actually showed that those people who had the infection and vaccination actually have much higher antibody levels than those that just had previous infection or vaccination. So really, after infection, the best thing is to get vaccinated. You are probably some of the more protected people based on the ability to develop new antibodies and new T-cell responses to the variants, and even the variants we haven't really seen yet, but we do anticipate there will be more variants. But again, as of yet, Delta is really the one variant that really is outcompeting everything else. So to answer the question, no, you are still better off if you had the infection and you get vaccinated compared to people who either got just vaccinated or especially had that natural infection. And especially if that natural infection was mild, you really don't have that breadth or that robust immune response compared to the other group that I talked about.
Linda has a question. I don't know if you know the answer to this, but she says, will the option for the booster appear in the KU My Chart? And I don't know what she's meaning. Probably is that at some point, will it not be you have to get that recommendation from the doctor, but that it'll just pop up in My Chart and tell you to come on in?
Yeah, I mean, it should. We are working on all those IT issues right now. Again, for our immunosuppressed patients, we know that it did pop up for them, and they were getting messaging about getting additional dosing. There is still some vagueness about the recommendations, as there are groups that should be recommended to get it, but yet there's also groups that may get it. So we are working on that messaging through the IT department. Again, the new recommendations really do cross a lot of lines and get a lot of people involved. And again, there is some vagueness in the wording as far as it is recommended for this group, especially over 65 and nursing home residents, but then other groups may get it if they choose, and those are some younger age groups as well.
All right, just a couple more questions. Dr. Hawkinson, Rebecca is asking you what your advice for those of us who got the J&J in terms of boosters.
Yeah. Again, I think we are going to be seeing in the next couple weeks more information about a second dose of Johnson & Johnson. So just hold tight. Again, all of the current data continue to suggest and show that even those who got the one dose of Johnson & Johnson are very well protected against hospitalization, severe disease, and death. So you have some time to wait. Take some comfort in that. But I think within the next couple weeks, we will be hearing both about Johnson & Johnson and Moderna additional dosing.
And our last question is going to be from Carla today. She says, I've heard of people who got both Pfizer vaccines who need a booster, and then getting a Moderna shot because they are hearing Moderna has better efficacy.
Yeah.
Where is the study at mixing vaccines? What should we do? Should we wait for Moderna? If we had Moderna, what's the advice there?
So there have been a couple articles looking at effectiveness, looking at Moderna, Pfizer, and Johnson & Johnson. There was a very well publicized MMWR report looking at them specifically, and it did look like there was a signal, data signal showing maybe Moderna has a better efficacy long term. But again, they are all continuing to be extremely effective. As far as mixing, I'm not really sure of specific data or publications looking at mixing. We know mixing has occurred. Again, for the most part, it looks safe. What are the full benefits? We don't know if really everything is the same or if there's higher benefits. We know that there are some mixing studies looking at AstraZeneca and then Pfizer. But again, we don't have the AstraZeneca vaccine here in the United States. Those studies were done in the UK specifically. So I think, again, there's just not a lot of data about Pfizer and then Moderna, or getting Moderna and then Pfizer. Overall, it really should be safe. They're very, very similar. What is the true benefit? I speculate and don't believe there's any increased benefit of mixing or matching right now. So we are still looking for the data on that.
All right, let's get to our final thoughts from Dr. Love. Great questions for you today.
Yeah, wonderful questions. I appreciate it and appreciate the time. So most importantly, if you're 12 and up, go ahead and get vaccinated if you haven't. It's never too late. Number two, if you notice any of those red flag symptoms, fever, or other people around you getting sick, definitely go and get tested or talk to your doctor about whether you should go and get tested. And then finally, if you have bad allergic symptoms, bad allergies, or even asthma this time of year, please call us. We'd be happy to see you at our clinics.
Are telehealth visits effective?
Yeah, actually, we are so lucky that telehealth has been great for us. We are now able to see people in Western Kansas for a lot of the allergic conditions that we see, as well as the immunodeficient conditions that we see. So it's been a big benefit for us.
Fantastic. Mm-hmm. Always good to see you. You will be back.
Mm-hmm.
You will be back for sure. It affects us all in some way or another. Dr. Hawkinson, final thoughts from you on this Monday.
Yeah, I mean, I think there were good vaccine questions, a lot of thoughtful and insightful questions, and people concerned. Again, the best data we have right now and the recommendations are for that additional Pfizer dosing. More information will come out about Moderna and Johnson & Johnson, but everybody please just take confidence in understanding that if you are fully vaccinated with any one of those three vaccines, you are still extremely protected against hospitalization, severe disease, and death. And when new information comes out, we will certainly report that to you.
Appreciate you both so much, and thank you all for being with us today. Tomorrow, we are back with Dr. Kevin Alt. He is joining us just hours ahead of the latest ACIP committee meeting. So we're going to talk about that. We're going to talk about what he expects to hear during the meeting, as we know that too many expectant mothers, postpartum mothers, are getting seriously ill with COVID-19. So bring your questions about pregnancy and, of course, all things COVID, because we're going to hear from Dr. Alt starting tomorrow at 8. Have a wonderful day. We'll see you then.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.